Are your antibiotics not working as effectively as they should? Could the foods and drinks you're consuming be making things worse? And is there a way to reverse this interference to get back on track with your treatment? In today's video, we'll uncover the common foods and beverages that can block your antibiotics from doing their job, and, most importantly, how to avoid or reverse these effects. By taking action, you can ensure a smoother, quicker recovery and prevent the frustrating consequences of reduced antibiotic effectiveness. Stick around to learn simple, science-backed steps to safeguard your health. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. Now, let's start our countdown with number 1, dairy products. Dairy products like milk, yogurt, and cheese are common in many diets, but they can create complications when taken alongside antibiotics. The calcium in dairy products can bind to specific antibiotics, such as tetracycline and ciprofloxacin, forming insoluble compounds that the body cannot absorb effectively. This binding action reduces the amount of antibiotic that enters your bloodstream, making the treatment less effective and potentially prolonging your illness. To mitigate this issue, it's recommended to schedule your dairy intake and antibiotic doses at different times. For example, if you take your antibiotic in the morning, you should enjoy your dairy products in the afternoon or evening, ensuring at least a 2-hour gap between them. Another approach is to choose non-dairy alternatives that are less likely to interfere with antibiotic absorption. Fortified, plant-based milk like almond or soy milk can provide the necessary nutrients without the risk of interaction. Additionally, reading food labels carefully can help you avoid hidden sources of calcium that might be present in processed foods. Some fortified cereals and juices also contain high levels of calcium, which could similarly interfere with your medication. Being mindful of these sources can help maintain the effectiveness of your antibiotics. It's also worth noting that some people may rely on calcium supplements to meet their dietary needs. If you're taking calcium supplements, schedule them at a different time from your antibiotic dose. Discussing your dietary habits and supplement use with your pharmacist can provide personalized advice to ensure your antibiotic treatment is as effective as possible. By making these adjustments to your diet, you can help ensure that your antibiotics work as intended, aiding in a quicker and more effective recovery. Number 2, iron-rich foods. Iron supplements and iron-rich foods, such as red meat, beans, and fortified cereals, can complicate the effectiveness of antibiotics in a manner similar to calcium. These nutrients can form insoluble complexes with certain antibiotics, particularly tetracyclines and fluoroquinolones, thereby reducing the amount of the medication that is absorbed into the bloodstream. This reduction in absorption can make your antibiotic treatment less effective in fighting off infections. To mitigate these interactions, appropriately timing your consumption of iron-rich foods and iron supplements is crucial. Aim to take your antibiotics at least 2 hours before or after consuming iron-containing foods or supplements. This spacing allows your body enough time to absorb the antibiotic without interference from the iron, ensuring that the medication can work effectively. For individuals who rely heavily on iron in their diets, this timing can be particularly challenging. In such cases, consulting with a pharmacist for personalized advice might be helpful. They may suggest specific scheduling or alternative antibiotic treatments that are less likely to interact with iron. Another aspect to consider is the type of iron supplement you are using. Some iron supplements are formulated to be slow release, which can prolong the time they stay in your digestive tract and increase the likelihood of interaction with your antibiotic. If you take slow-release iron supplements, discuss with your healthcare provider how best to manage the timing of these supplements concerning your antibiotic doses. It's also essential to read labels on fortified foods and be mindful of hidden sources of iron, which can be present in products like cereals, bread, and specific plant-based proteins. Number 3, antacids and acidic foods. Antacids containing aluminum, magnesium, or calcium can significantly interfere with the effectiveness of antibiotics. These minerals can bind to specific antibiotics, such as tetracyclines and fluoroquinolones, forming insoluble complexes that the body cannot readily absorb. This binding action reduces the amount of antibiotic that enters your bloodstream, potentially compromising the treatment and prolonging the infection. Acidic foods such as tomatoes, vinegar, and citrus fruits can also alter the stomach's pH levels, impacting the absorption and metabolism of certain antibiotics. A highly acidic environment can either enhance or diminish the effectiveness of the medication, depending on the type of antibiotic. For example, some antibiotics require a neutral pH to be fully effective, while others may be absorbed better in a more acidic environment. This variation can make it challenging to predict how your diet might interact with your medication. To minimize these interactions, it is advisable to space out the consumption of antacids and antibiotics by at least 2 hours. This timing helps to ensure that the antibiotic has sufficient time to be absorbed before the antacid alters the stomach's pH or binds to the medication. Additionally, consider choosing more neutral foods during your antibiotic treatment. Foods like cucumbers, sweet potatoes, and most leafy greens are less likely to impact the stomach's acidity and can provide essential nutrients without compromising your medication. If you frequently use antacids for conditions like acid reflux or heartburn, discuss with your pharmacist the best strategy to manage both your antacid use and antibiotic treatment. They may recommend alternative medications or timing adjustments to ensure both treatments are effective. Number 4. High-fiber foods. High-fiber foods are well known for their health benefits, such as promoting digestion and maintaining stable blood sugar levels. However, these same foods can pose a challenge when it comes to taking antibiotics. Fiber can bind to certain medications in your digestive tract, reducing their absorption into your bloodstream. This binding action is similar to what happens with calcium and iron, but it involves the indigestible parts of plant-based foods. Foods rich in fiber, such as whole grains, beans, lentils, and vegetables like broccoli and Brussels sprouts, are usually staples in a balanced diet. Yet, when you're on antibiotics, the fiber in these foods can prevent the medication from fully absorbing, making your treatment less effective. The insoluble fibers, in particular, found in whole wheat products and the skins of fruits and vegetables, can significantly hinder the antibiotic's ability to combat bacterial infections. One way to manage this is by timing your meals and medication wisely. It is generally advised to take antibiotics on an empty stomach, depending on the type of antibiotic used, for better absorption. This usually means taking your medication at least 1 hour before or 2 hours after consuming high-fiber foods. This timing helps ensure that your digestive system is transparent, allowing the antibiotic to pass through more efficiently and enter your bloodstream without interfering with fiber. Another strategy is temporarily adjusting your diet while undergoing antibiotic treatment. Opt for low-fiber foods that won't compromise your medication's effectiveness. White rice, skinless potatoes, and low-fiber fruits like melons and peaches can be safer choices during this period. However, consult your pharmacist before making significant dietary changes, primarily if you rely on a high-fiber diet for other health conditions. Additionally, fiber supplements can pose the same issue. If you regularly take fiber supplements, consider scheduling them at a different time than your antibiotic dose. Discuss with your pharmacist to establish a schedule that ensures your fiber intake and antibiotic treatment are effective. Number 5. Caffeine. Caffeine, commonly found in coffee, tea, and certain soft drinks, can significantly impact the metabolism of various antibiotics. Some antibiotics, such as ciprofloxacin and norfloxacin, inhibit the enzymes responsible for breaking down caffeine in your liver. This interaction can lead to an accumulation of caffeine in your system, resulting in heightened side effects like jitteriness, increased heart rate, and sleep disturbances. The compounded effects of caffeine and these antibiotics can make it difficult for you to rest and recover, which is crucial when battling a bacterial infection. In addition, elevated caffeine levels can increase anxiety and stress, further taxing your body during a time when it needs to focus on healing. To mitigate these interactions, limiting your caffeine intake while on antibiotics is advisable. Opt for herbal teas, decaffeinated coffee, or other caffeine-free beverages to avoid these unwanted side effects. Timing also plays a role. Avoid consuming caffeinated drinks within a few hours of taking your antibiotic dose to allow your body to process each substance more efficiently. Being mindful of hidden sources of caffeine is equally essential. Energy drinks, certain over-the-counter medications, and even some foods like chocolate contain caffeine, which can contribute to its accumulation in your body. Reading labels and making conscious choices about your consumption can help manage the potential side effects and improve the efficacy of your antibiotic. Number 6, alcohol. Alcohol can have a considerable impact on how antibiotics function in your body, either by diminishing their efficacy or amplifying their side effects. One notable interaction occurs with antibiotics like metronidazole and tinidazole, where alcohol consumption can lead to severe reactions such as flushing, nausea, and a rapid heart rate. This is because alcohol and these specific antibiotics are metabolized in the liver by the same enzymes, leading to a toxic buildup of acetaldehyde, a byproduct of alcohol metabolism. Additionally, alcohol can weaken your immune system, making it harder for your body to combat bacterial infections. This dual action, compromising both the antibiotic's effectiveness and your immune response, can prolong illness and complicate recovery. Other antibiotics, such as doxycycline and erythromycin, can also interact adversely with alcohol, potentially leading to increased side effects like stomach upset and dizziness. The metabolism of antibiotics can be further complicated by alcohol's diuretic effects, which can lead to dehydration. Dehydration reduces the efficiency of your kidneys in filtering and excreting medications, thereby affecting the concentration and efficacy of antibiotics in your system. This not only diminishes the drug's ability to fight off infection, but also heightens the likelihood of experiencing side effects. Given these potential interactions, it's advisable to avoid alcohol entirely while you're on antibiotics. This avoidance extends to both prescription and over-the-counter medications that contain alcohol, such as certain cough syrups. If abstaining from alcohol proves challenging, make sure to discuss your options with your pharmacist to ensure that your antibiotic treatment remains effective. Always consult your pharmacist for personalized advice tailored to your antibiotic and lifestyle needs. Lastly, citrus fruits and juices. Citrus fruits, mainly grapefruit, can significantly alter how certain antibiotics work in your body. The compounds found in grapefruit, such as furanocoumarins, can inhibit cytochrome P450 enzymes in the liver, which are responsible for metabolizing many medications, including antibiotics like erythromycin and amoxicillin. When these enzymes are inhibited, it can lead to higher concentrations of the drug in your bloodstream, increasing the risk of adverse side effects like nausea, dizziness, and even toxicity. It's not just grapefruit that poses a problem. Other citrus fruits like oranges, lemons, and limes can also interfere, although to a lesser extent. These interactions can be particularly concerning for antibiotics that require precise dosing to be effective. The imbalance caused by consuming these fruits can disrupt the medication's therapeutic levels, making it less effective in treating your infection. To avoid these issues, it is recommended to steer clear of citrus fruits and their juices while on a course of antibiotics. Instead, choose alternative fruits that do not interact with your medication. Apples, pears, and bananas are generally safe options and can provide essential vitamins and nutrients without compromising your treatment. If you enjoy citrus fruits and find it challenging to eliminate them from your diet, consider consuming them at a different time than your antibiotic dose. Maintaining a gap of at least 3 to 4 hours between eating citrus fruits and taking your medication can help minimize the interaction risk. Consult your physician for personalized advice tailored to your specific antibiotic and dietary preferences. And there you have it. By avoiding these 7 foods and drinks while on antibiotics, you can ensure your medication works as effectively as possible. Remember, antibiotics are powerful tools in fighting infections, but their success depends on how we support them with our diet and habits. If you're unsure about any food interactions or need personalized advice, don't hesitate to consult your doctor. Thanks for watching, and if you found this video helpful, be sure to like, share, and subscribe for more health tips. Stay healthy, and I'll see you in the next video.